you know, I don't know. But I was taking 50 milligrams of metoprolol once a day. And then I increased it to 2 a day, one in the morning, one at night. And that seemed to have helped a little bit. And then when I ended up in the hospital that day, and they did that quick restart, rejump the heart, they said, you know, you're taking the metoprolol 50, and then you increased it, right? Yeah, I did. Because any changes I make or notes goes into their system. So if I'm in the emergency room, for instance, and they're in my system, they'll see what I noted and what I'm doing. And at that point, I said, yeah. He says, you know what? How about if we put you on 100 extended release? So what it does is, you know, it's like a 24-hour pill. Well, since they put me on that, well, first they put me on a 50. Because when I took it, it was making me sometimes feel like I wasn't breathing. You know, you ever look for that cleansing breath, that satisfying breath? Well, if I took too much of the metoprolol, like the 250 of regulars, it would help with the heart palpitations, but it would also sometimes make me feel like I'm not getting enough air. I can't get that satisfying breath. And believe it or not, that is kind of a strange feeling, because you know you're breathing. You have to tell yourself that you're breathing. And naturally you don't want to panic, thinking that, oh shit, I'm not breathing. Because then you'll start going into all kinds of stages. You know, and it's not a panic attack, it's the medication that's causing it. So meanwhile, they said, let's put you on 100 ER. No, 50 ER. 50 ER. So they put me on 50 ER. And I really didn't notice a difference. It really wasn't doing anything for me. You know, it just wasn't doing it. So I started taking 2 in the morning. Because, you know, if you're going to increase, you know, 1 a day, well then I don't want to take 1 in the morning, 1 at night. So I'm going to take 2 in the morning, you know. And I took 2 in the morning. I started feeling good. Right? You know, no more. Well, since then I haven't had any of these heartbeats to put me out of commission. Because I'll tell you, it puts you down. It really does. For those of you who've had them, I'm sure you know what I'm talking about. You know, to have it for a minute or 2 is one thing, but when it goes on for 3, 4, 5 hours. Oh. But meanwhile, since then everything's been fine. So that's my funny heartbeat doctor. Now the doctor I haven't seen yet, which is my normal heart doctor. So I'll see her April. I just made an appointment with her. And she wants to make sure everything is going all right. How do I feel? You know, they do some blood work. They want to make sure that your enzymes or whatever it is working. I know she's going to want to set up a stress test, but I really don't think I need it right now. I do want to do. I want to have a stress test. I just don't feel like having one within the next couple of months. I want to wait until summer's here, you know, and I get out there and I get active again. then I won't notice it as much. They'll say, well, we can always give you the needle to increase your heartbeat. No. I'll do it the right way, or the way that I'll walk it, on the treadmill. I don't want to take any chances of somebody juicing me up a little too much, and next thing you know, the paddles are coming in. If I'm on the treadmill and I start feeling, I'll stop. So that's all there is to it.
WW Freestyle is for everybody who wants to eat the foods they love.
Oh, excuse me. All right, so that's on there. I put some contact cement on it. That should be okay. And I have a copy over here. So what I'll do is I'll cut this off and I'll slide it inside. So I might as well do that now. Because it's not on anything that I wrote on. So you cut that off.
First, no chicken or poultry byproduct meals, no corn, wheat, or soy. Add it all up and there's only one choice for me. Wholesome and healthy Blue Buffalo. Trying to hide excessive sweating. It's not just stress.
Hey, it's Thursday already, huh?
And many people don't know they have it. Even if they have tricks to try to hide it.
Today is Thursday already. We'll take a little bit of this. Clean that edge off. I'm going to get all that crap hanging around. This is clear vinyl. It's good for if you want to print on something. But I also use it as laminate. And sometimes you need to put a clear vinyl over something you've done to help protect it.
Mine says it's going to rain 96% chance.
Alright, so
Depending on what it is that you're doing,
Thank you
we
so
got
much.
people arriving literally any
would
second.
depend on
Not to rush you, but rush.
how you use it. I mean, sometimes you can just use it as a. The hell did I go with my blue tape? I'm telling you, I can't find my blues. My blue masking tape. I have a new roll there, but I can't find my roll that I was
This
using.
is exactly what I do not need.
But meanwhile, back at the ranch,
Is that you?
as I was saying, sometimes you can use the vinyl and you have to cut it a hair bigger, than the lettering, an eighth of an inch or so bigger than the actual lettering. So when you put it over it, it'll protect it.
Anywhere you want to look at it from here? Can you look at like 10
And you won't notice it.
down the best part of this apartment? And I don't know if this rain's going to stop.
Or sometimes you just
Check with the door. They don't
cut out a nice square sheet and put the whole square over it.
them upstairs.
It all depends on what you're doing.
Door's there, Jesse.
I'm putting my stuff down. My drink.
You try to follow the shape as much as you can if you want to kind of keep a neat job. However, it's a pain in the ass sometimes. That's where you want a laminate machine because it makes things a lot easier to have a laminating machine than trying to use anything else.
So the kitchen, all melee appliances, I love it.
What's that other piece? Here it is.
Door number one? No, even better.
Here's this one.
Wine, look at that.
No, let me use this one. Yeah, so I keep spare pieces. If I'm using it, I just keep the pieces because you never know when you're going to need it for something. I mean, even like
All private for this penthouse.
shipping a package if you want to use it as tape. Or you want to use it over a shipping label to protect the label.
Rain or shine, it came through. And you know what?
kind of
People loved it. I got really good response.
good to have
Now if
one.
I get them back on a sunny day, the expectations will be blown away. Good turnout. Very happy.
So anyway, guys,
In the clutch.
it's getting in the afternoon, later part of the day.
Thank you.
I think I'm gonna go in the house, have a bite to eat. I gotta watch some. I got 2 videos completely done
For that. Any reaction of the body
with test. I gotta get a few more done.
That 72 hour span. You know, we go through the plan before and the whole transition needs to happen really quick.
Actually, there's some that I have to take online
Anna has been, let's be honest, not thrilled with my
because
performance thus far. I was distracted.
the deputy chief
Going to get
said he'll let me
There's no choice.
give the test, you know, at the meetings.
I'll send you a report later tonight how tonight went, and I'll send you a
But I gotta take the test in order to get the test.
I'm gonna go get that and give another tour.
You know what I mean? Alright, so this is done. So I'm going to take this and fold it up, or roll it up, whichever.
Tonight I have my big event for Juan Invest, and I invited everybody. We have hundreds of brokers.
Stick it in here. Actually, it'd be better if I fold it.
Also ask their salesmen come.
Yeah,
My whole
okay.
career, I've been waiting to throw an open house with like a huge
Stick it in
massive
there.
kitchen and sushi. Can I test? You probably lose like
Okay,
that.
so that's always theirs. It's always there. So now we disconnect the power.
Very good.
Turn this off. Solder station's off. This is done. That's there. This is made. I'm going to leave that alone. I'm not going to do any more with that.
Just seeing 40,000 square feet of amenities. Are you excited?
And we're going to get ready and go in.